All right. Well, thank you all for being here. Welcome to our One for the Ages lunchtime presentation. Like I mentioned, I hit record, so it's up to you if you want to mute your audio and video so we can focus on the speaker. That's great. I want to just take a moment and plug our 100th centennial. So Scripps is celebrating 100 years this year. And in a moment here, I'll put the link to our event in the chat and you'll be able to find out more information. The weekend is September 9th and 10th in Oxford in person. So we'll hope you'll join us. And like I said, I'll get that link in just a minute. So now I want to welcome one of our alumni. So Cho, thank you so much for joining us all the way from San Francisco, California. She is going to be talking about choosing home care services. And Cho is an alumna of the MGS program from 2001. She's also a licensed nursing home administrator, and she serves as the executive director of Compassionate Community Care, an award-winning organization that provides home care and geriatric care management services in the San Francisco Bay Area. So Cho, I'm going to pass it over to you and you can go ahead and launch your presentation.
Okay, thank you very much. And I want to thank you for giving me the opportunity to present today. And it's such an honor. And I want to congratulate the centennial anniversary. It's so wonderful.
And as you're getting that started, Cho, I just wanted to say if anyone has any questions throughout this, you can feel free to put it in the chat or hold your question to the end and share. It's totally up to you, but Cho is happy to answer any questions that you might have.
Okay, so we're going to talk something about choosing home care. Here's the agenda for the day. So where do you start when you search for the home care services? And what's the benefit and how to choose the right agency? Because there are many agencies out there. And what's the differences between home care agency, private pay, and the referral agency? And why choosing home care services can reduce medical costs?
Cho, are you able to, your audio is kind of quiet. Are you able to turn up your audio or maybe just speak a little louder? We're having a little bit of trouble hearing.
I'm sorry. Let me. Is it better now? Is it better? Oh, I cannot. Do you hear me okay? Oh, I don't know why I cannot hear you now.
Yes, we can hear you. Sorry.
Oh, now I can hear you.
Yep.
Oh, okay. Sorry. Okay, now I can hear you. Okay. Yeah, I want to tell briefly the differences between home care and home health. Probably you know what's the difference. Home care usually refer to we provide non-medical. Home health care provide medical care. Some people, including professionals, when they say home care, but they are actually referring to home health and vice versa. And also some people and insurance companies, they call home care as attendant care or custodial care. Some place they may also say differently as well. I usually caution our client when they say, oh, I have insurance cover for my home care services. I usually suggest them double check to see if they really cover what you need for home care, like personal care, getting in and out of bed, cooking, things like that, or they refer to the therapist and social worker or nurse visit, or they may even have like a home health aide, but that's usually a very short visit. That helps to clarify so they won't under the impression that it will be covered, but in the end, it's not. Okay, where to start? You may begin your search by assessing the level of care, the budget, and identify the home care needs. So when you assess the level of care, you want to know what is the mental status? Can they get up and down from the bed or the chair? How they transfer? Can they get in out of bed, the shower, or the bathtub safely themselves? And how about their walking and eating, and how they dress? Can they dress themselves? And also toileting. Can they groom, shower, and bathe themselves safely? And also you want to know if they can manage their medications and if they need some supervision for safety. Can they prepare their own meals, go grocery shopping, do laundry, and running errands? Many seniors, especially when they get older, like in 80s or 90s, it's hard for them to prepare meals. So they may often use TV dinner, which we know is not the most nutritious meals. So if you want them to have the fresh cooked meal, so you may look into the options. Some places may have, like in San Francisco, we have home delivered meal from Meals on Wheels and some other senior providers. So it's good to look into. Can they coordinate and go to doctor's appointment, which is important. Often the doctors, or when we work with some professionals, they told us the client or the patient cannot make to the appointments. Are they lonely? And do they need companionship and or socialization? It's pretty common when people live by themselves and they feel lonely, and which may lead to depression and other health-related issues. Can they keep their home clean and tidy? Most of the clients, they like to keep their home clean, but because of the physical condition, they may not be able to. Cost is a very important factor because home care can be very expensive depending on the level of care needed and the care options. And most of the private home care services is paid out of pocket. Medicare Advantage plan started to cover some of the home care. I heard about it in the last 2 or 3 years, but I haven't seen that happening in San Francisco. So it's promising, hopefully we'll cover. And some of the private long-term care insurance may cover part, if not of the home care services. We often get people, they ask, oh, I have like Blue Cross, Blue Shield, do they cover? Usually they don't. They cover home health, but not home care. And there are also maybe some local community-based organizations, like some nonprofit organizations, they may cover some subsidized home care, or they may also have some grant or some government funding from the local city or state, or they may even have some federal support for the home care services. In San Francisco, we have like a support at home. It's a good pilot program, has been around for a few years. It helps people who are not eligible for Medi-Cal to be able to use the home care services. How it works is the client, if they're eligible, enrolled in the program, they only need to pay a small co-payment, and the government will cover for the larger proportion of the services. So it's a very good program. And also in San Francisco and the Bay Area, we also have some grant, like say cover respite care for hospice care or Alzheimer, people who have Alzheimer's disease, dementia, and also some private nonprofit organizations. And nowadays, even like in the hospitals, they may have some charity fund to help people who cannot afford the services. It's heartbreaking to see some people, they really need the service, but they have very limited funds. Most of us are falling into the middle. When people have a lot of money, they can afford a private home care, no problem. For people who are low income, they're eligible for medical. And then when they're eligible to receive services at home, they may get in-home supportive services and no cost to them. So the middle, that's the hard part. So many of us fall into that category. It's hard for us to pay for a lot of home care services. We often help people to transition. It's important for people to get the care they need. And especially when they have some kind of impairment already, just a few hours, even 4 hours a week, or once or twice, that may help to prevent them from having other issues. It's hard to get people to provide like only 4 hours service, but sometimes that's what people need. Maybe once a week, or once every other week, or once a month. Just be preventative. That helps save money for long run. So what are the benefits of home care services? Most of us want to stay in our own home. It's comforting. And the ability to remain in the comfort of their own home creates a healthy and healing environment. Many of the research shows the close relationship of the physical and mental health related closely. And it helps empower them to be independent and happy while living in their own home in their own way. We want to eat the time we eat, and we want to do the things we want to do at our own home. And also helps improve the quality of life. Study shows that many people reported having a happier and greater quality of life with the home care services. Okay, you may ask, how to choose the right agency? There are so many agencies out there. So how can I choose? It can be challenging. So in terms of choosing the right agency, you may want to ask the following questions just for your references. You want the agency, what kind of services they provide? And do they tailor the services to the client's needs? Like just like us, we want people to help us in the way we want it, right? We all have our preferences. So it's very important to know. We want to provide the client-centered care, not whatever they give us. And also you may ask if they have qualified professionals to conduct in-person assessment and create a customized care plan. The good quality service may start with a good assessment and a care plan. Don't assume they're all the qualified professionals. Because there is no strict requirement what qualifications the home care professional they need to have. So each different agencies may have different people to work over there. I met some people who used to be in childcare, now work in the elderly care or in other field. Because before we have a license, even now, not all the states require a license for home care agency. Even in San Francisco, California, we did not have license for home care a few years ago. To open a home care, it's like you just get a business certificate, just like to open a coffee shop. very simple. Nowadays, there is a license, there's some more requirement, but there's no requirement what qualification the staff needs to have. They do have a requirement for home care aid, the frontline workers, but not the people who work in the company. A thorough, personalized care plan can address the individual needs because we're all unique individuals and we may have different needs and different precautions needs to be aware of, especially the elderly people. They may have all kinds of health conditions. And also you may ask, how do the agency train and supervise their caregivers? Training is very important. I'm a strong believer of training. I'm grateful to have the training or education from scripts when I was in school, and it's good foundation helped me to do what I do. Training may be online and in person. It's good to have the combination. I know a lot of people, they do the virtual or online. It's good to have, and it will be better if there is in-person training. So in that way, you will know if the employee actually know how to transfer the client properly, for example. How to provide the bedside care, even as simple as changing the diapers, it makes a difference. And also how they help the client move on the bed, because you don't want to injure them. When we provide training, we usually have a registered nurse help train our employees. She does great training. And it's often we see the employees, even though they may have many years of experience working in the field as a caregiver, but they may have repeat the same mistakes during their work. And also there may be better ways to do even the same thing and make it easier for the client and more comfortable for the client and more safe for both of them, the client and the caregivers. And you want to know if the caregivers are able to handle the client properly. Like when people have dementia. So do they know how to work with people with dementia, Alzheimer's, which is very common. If they know what to do, that helps the job satisfaction and also the client's satisfaction. Are the caregiver able to report the changes of conditions and when the client need to have medical assistance? It's very important to know the signs and symptoms when the client may need medical attention. In that way, the client's condition can be addressed, the client's needs can be addressed quickly. And communication is very important. You want to know if the staff communicate with each other effectively and timely. The client may have different caregivers, depends on the care needs and also the hours they need. A client may have 24-hour care. There may be different people, there must be different people involved. In the past, people may provide living care. Nowadays, most of the reputable agencies in San Francisco do not provide living care. We do provide 24/7 care, but we will rotate 2 or 3 people per day. So it's so important to communicate that people know the client's condition and they know what's the best baseline. And another very important issue we may not think about, but it's important to the client, like say, how many days they haven't had the bowel movement. So we know to dress accordingly. If a client did not have bowel movement like 3 days, so we need to do something about it. And do they foster the client's independence and autonomy? Many clients like to be independent and they want to do what they can do. But you also need to be aware that there are some people, they may not. And often caregivers, they may mean well. They want to help the best they can. They want to do whatever they can to please the client, but sometimes may not be what the client want. They want their independence. They like to do what they want to do or can do. So it's important to ask at the beginning. And it's very important to find out if they know how to handle the emergency situations. We don't want to have the caregiver freak out. It happens often when we have an employee to go to a client's home. The client can be on the floor, and it can be life-saving when we respond quickly. If an agency, they train the employee how to respond quickly. Like say when the client fall, if there's bleeding or the client have hard time breathing, they need to call 911 right away. You also want to find out, can they walk around your schedule? Can they respond to your needs quickly? Different clients may have different schedules. Sometimes people, they want the services when they need to have a break or they need to go to the office. Nowadays, during the pandemic, people, they work at home. So they only want to have certain hours and certain days when they go to work in the office. And the client's condition may change, can change sometimes very quickly. We see some clients, like say, started with the goal of rehab, but ended up the client's condition changed so quickly sometimes from rehab, then enrolled in palliative care, and sometimes very quickly, they need a hospice. And we need to adjust the care plan very quickly. And of course, needs to inform the caregivers quickly as well, so they know what to expect and what to do to help the client properly. You want to know, can a caregiver go to the hospital with the clients or go to the appointments? Some people may want to go to the church or go to movies or shopping, etc. And are they skilled and experienced with the clients with different medical conditions, like a dementia, Alzheimer, or a post-stroke or post-surgery? It's often nowadays people have knee replacement or hip replacement, knee replacement. And also the palliative care. Are they scared with that, or are they able to skilled with it? Are the caregiver able to cook and monitor the diet? Food is comforting. It's very important to know if the caregiver is able to cook the meal that we like. And many people may have diet restriction. So we want to know if they can follow, for example, the recipes. And some people may have low salt, low fat, or low sugar diet. Some people may have some diet because they have kidney issues or heart issues. And also you want to know if they can help you some cleaning at the house or run some errands. It makes a big difference if the caregivers are well trained. And also if they do fingerprinting background check. Before we have the license for home care in California, there is no such requirement. But now in California, it is required. All of the employees in home care agency, they need to do fingerprint background check through the local, like for example, Department of Justice and FBI. And you want to see if it's affordable. And of course, it's relative, depends on the hours that you may need and the level of care. You want to read the contract carefully. Is there any hidden fees or extra charge? In San Francisco, we are required to pay the employee like a healthcare contribution and sick leave. And of course, there are many other costs as well. So there are people, they may charge you a fee, then they may have additional fee involved. And also you want to know when you need to terminate the contract or cancel the service or change the hours, what's the requirement? And if there is any fee involved, and what are they? So there are different options for home care. So there's a full service agency or referral agency, private hire. And some people, they may also get help from friends and family, which help reduce the cost. And if the client is in a good condition, they can go to daycare. That can also help reduce the cost for home care as well. There's a severe shortage for the caregivers nationwide. I'm going to tell briefly the differences between home care agency and private hire. For full service home care agency, usually require, it is a requirement they hire their own employees. And a good agency usually have extensive recruiting, screening, and hiring process, and also the training and coaching. The caregiver agency, as I said, they usually they need to have the employee fingerprinted background check. In California, that's a requirement. It may not be required in all other states. So you may ask. So home care agency also include care coordination and supervision. They take care of the employee's payroll taxes, workers' comp, healthcare costs, sick leave. But that's in California, the healthcare contribution and sick leave. Some states may not. Even in California, it's not required before. In San Francisco, the sick leave as well. It is very important, especially when people need hire multiple caregivers to help an elderly person, especially when a person call off. You don't want to struggle last minute, but you have a schedule. Often people, they have, especially when they're still working or have family responsibilities, they want to be able to count on the caregivers. And also when there's a change, they count on the agencies to help coordinate. It can be very time consuming. And also home care agencies usually have the qualified professionals to do assessment and make a care plan to address the client's needs effectively. Usually the 24/7 for urgency is covered by a senior management team for the professional staff. That's something you may ask as well. Who covers for emergency calls? Are they really trained? It's make the difference. That's why we want to choose a good, reputable agency that can provide the support whenever it's needed. Because home care does not stop after the office hours, especially when a client needs the help in the evening or early morning or 24-hour. Cost is very high when using a home care agency, a good one, and especially when you need like a lot of hours, like 24/7 care. But you get what you pay for, and you may have a peace of mind. Private hire, it's getting even more popular in a way because the cost is getting so expensive nowadays. But on the other hand, when the clients hire a caregiver privately, they need to be responsible for all of the employer duties. The client is employer, which means they need to take care of the employees or the caregivers' payroll taxes, the workers' comp. When the person gets injured at home, that can be costly. And it can be very time consuming, as well if they need to coordinate with different caregivers when they call off. And also when they need to hire multiple caregivers, they need to take care of all of their payroll issues and other issues involved. We sometimes get a client that call us. Actually, most of the clients who use us, they would rather go with a full service agency, of course, a good one, other than dealing with all of those employees' responsibilities and the headaches during the coordination. And there are also referral agencies. Some people may not realize there's quite a bit of difference between a full service agency or referral agency, because from the name, sometimes usually you cannot tell. What you need to know is when you use a referral agency, the client is usually the employer. So that's the difference. Full service agency, the agency is employer. The referral agency, the client is employer. As a client, you may ask how the agency screen the caregivers. And the client will be responsible for all the employer's responsibility, just like the private hire. You need to take care of the payroll, taxes, workers' comp. And client usually pay a referral fee to the agency and the wages to a caregiver. Substitute may be available through the agency when the employee call off. So you can ask. Sometimes it may take longer time than home care agencies. The cost is usually lower than the home care agencies. So when you call the agency, the fee is lower, you want to ask, are you a referral agency or you are a full service agency? And they may be time consuming when you need to coordinate when the caregiver called off or when a caregiver needs to have a schedule change. Why choosing home care services may reduce the medical costs? It helps to discharge the client faster from hospital to home. It helps the safe landing. It also helps reduce their readmission to the hospitals. Usually hospitals want to discharge a patient out as soon as they can when the patient is medically cleared. But sometimes the client's home may not be ready. So when they go home, that's what we have experienced sometimes. The client's home could be a mess and they do not have the food and they may end up go back to the hospital pretty quickly, or they may fall. Some people, they may have services from like home health, but it may, because they don't have to start right away. And they sometimes may not be able to start right away. And they have a window before they start. But sometimes before that happens, the client is already went back to the hospital. It may also help to prevent unnecessary ER visits. Some seniors may need home care to stay at the home safely. Some people occasionally may call 911 or go to the ER because they don't have the caregiver support. Just yesterday, we have the hospital call us, want us to help their patient picked up from the ED, but ended up the family, they did not want to take the patient home. Ended up the hospital has to admit the patient. There is no medical need, but they cannot discharge the client when the family does not want to take the client home. And you know the hospital stay is very expensive. So I hope this gives you some better insight about choosing home care. So please let me know any questions that you may have.
Thank you, Cho. So thank you very much. And Your audio went out kind of at the very end. So you're asking for questions, right?
Yes, I'm sorry.
Yes. So anyone has any questions, you can feel free to unmute or put something in the chat. And I see Pam Mayberry put something in the chat for you, Cho. Are you able to see that?
Let me see. That's a good question. So the question is, let me see the top.
Yeah, I had a similar
Okay.
question to that, Pam. That's a good question.
That's a very good question. Yeah, so do you mind me to reading this, Pam?
Go right ahead.
Okay, so my mother in rural Illinois has been getting home care services from an agency to help with cleaning. It has been very helpful, but she has gaps in services for many weeks each time and the frequent changes in care workers due to high turnover. There are only 3 home care agencies that serve her area, and the high turnover is a nationwide problem. And I wonder if we have any similar challenges in San Francisco. Yes. It's so difficult to recruit the good quality caregiver nowadays. And most of the caregiver, maybe should I stop sharing so we can? Okay. And it's hard to find an employee who want to only work like a few hours a day, like 4 hours, for example. That's why some agencies, they require, like in San Francisco, they require a few times, like 3 times a week. Or some agents refuse to take less than 6 hours per shift. And caregivers usually like to work long shift, 8 hours or plus, because the cost of it in San Francisco is very expensive. And so that's also good to ask the questions at the beginning. And also it may help if your schedule can be flexible. That's when we do intake, we usually ask people, what's your first preferred hours and the time, and can the days be flexible? And they tell us some of them can be flexible, some of them cannot. And we ask them, would you like to have like a different caregivers keep the same time? Or you would rather to have the same caregiver and you can be flexible on the time and days. So that may help. Yeah. We usually have a client say, oh, I want the same caregiver. I only want one caregiver. Then I would mention to them, because especially nowadays with the COVID, many people, they may be exposed to it. So they can call off suddenly from time to time. And usually we, if we know ahead of time, so now we know some client, they only want one caregiver. So when this caregiver is not available, we just cancel it. Yeah, or we sometimes introduce 2 caregiver or 3 if they're open to it. So in that way, they already know the caregiver. And then when one caregiver is not available, they're open to another one. So that may be helpful. That's a very good question.
So I don't know if anyone else has any other questions, but there's another, actually, Cho, there's a couple things in the chat for you.
Okay.
So someone, Heather says, my dad is 88 and just lost my mother. I'm so sorry to hear that, Heather. He is resistant to any help or ideas for care. He has been hospitalized twice in the last month. Any advice is appreciated.
Yeah, that's a very good question. And also it's very common to us as well. So I would suggest, it depends on the situation, right? I don't know if your mom had the service before she passed away. Sometimes may be helpful if you have the same caregiver that you like, for example, if your dad feel comfortable, then may have that person to start, or you may have him to try once. We have these questions very often. For example, if the client, like say your dad, if he will be open to have somebody, let's say, that he may like male, for example, and also especially your dad just lost his wife, he's grieving. You may look into to see if there's some support group for grieving services. That may help lift his spirit. Grieving will not go away, and it will be a long time. And your father is get affected the most. And usually men, they do not express themselves. But it's so important. Sometimes, like in San Francisco, we have people, we sometimes suggest them to go to a support group. Or sometimes there are friendship lines, they can talk with people. Or you need to find out like what's the reason to assist. Okay, he does not like the idea at all, but maybe suggest in a way, well, since he's been to the hospital twice already, he's fortunate, hopefully it's nothing serious. But sometimes what happens is they may fall or they may have a fracture, and then they ended up they will need a higher level of care. Or you may try to convince like, well, could you just do that for me, right? For your child. So you'll have a peace of mind, and then to see if your dad will be open to that. Or just have a trial to see if you'll like that. We had a professional, she was so cared for her dad. And that's what we did. So we had somebody, a male, because we know that his dad like somebody to relate with, and then find out the preference that he has, and you try to prepare the caregiver. Or instead of saying the caregiver, you may say, I got this volunteer from the hospital. And some people, they don't want to have a care or they're concerned about the cost. But if you say, you know what, the hospital sent somebody, want you to stay at home to be safe, or some community volunteer program that maybe help you. You just try it once to see if that works. Because that may help his grieving. And then maybe he will be open to it and find out what kind of hobby that he may like. Or like simply if he's able to walk, maybe walk with him or listen to some music or something. Probably he may need help, like say, do some cleaning or laundry, or if he likes the food, if the caregiver is a good cook, don't mention it's the caregiver. Or you can even mention, hey, I have a friend who come to help. To see if that your dad will be open to it.
Thank you for that. So there's another comment in the chat from Katie Abbott. How are client preferences for care and activities communicated across different staff members, especially if there are multiple caregivers, as this seems to be important?
That is very important. Yes. For us, how we do is usually we want the clients to tell us anytime from the intake, right? So we know the client's preferences, and then we include that in the care plan. And then we do a match before we send the caregiver based on the information. That's why I mentioned about you want to have the agency to see if they do proper assessment. That's part of the thing you need to be included in the care plan. Because you want to make the client feel comfortable, your loved one feel comfortable. And especially when you have different caregivers, things are so easy to fall through the crack. Like say when there's a change of condition, the client's condition can change frequently, especially like client already have some chronic disease like dementia, Alzheimer, right? Or they have a fall, right? Once the fall happens, or if the client is already fall risk, or if the client enrolled in hospice, that can change day by day or weekly. So it's very important you want to know the agency to be able to communicate. So for us, usually we respond very quickly. And we ask the client to tell us, not, you don't want to tell just one caregiver. It's good to tell one caregiver who's working on that day if you're there. And also make sure to let the agency know. And the agency, they need to make sure to inform all the caregivers. And it's important, like sometimes they change the shifts and to help communication if they have like communication logs or the daily sheets. That helps communication because let's say if you only need 4 hours a day, and there may be different caregiver on different days, so they can refer to the note. Or if the client have the 24-hour care, right? So if the daytime the person is sleeping a lot, then you may concern, oh, is it a change of condition or what happened? Then you can refer to the note, oh, actually the client slept a lot the night before, right? And also through the communication between caregivers, they say, well, the client is not, haven't had bowel movement for 2 days. Well, the person in other days, they say, okay, the third day, I need to report to the agency. They need to do something about it. Or if the client start to have like a hospice client, for example, they started to have morphine or they stop all the meds when the client's condition changes. So you need to know that. Or sometimes they have a swallow issue when they started care, and then later on they're getting better, and the vice versa.
All right, thank you for that. Scott, I'm going to read through your message here. That's a good question, and please, if you want to contribute anything else, but Scott says, my late grandmother died in 2017 at age 97, had home care for cleaning and meals the last couple of years, but fought us on providing that care earlier, saying she didn't need help cleaning. A bit of pride in her home, I think. As I look to my parents' generation, who's in their late 70s, I wonder if you have noticed a cohort shift to less resistance and this type of in-home support.
It depends. I think it depends on the individual. Because in general, seniors, they're very resistant. They overestimate the capacity. I hope we'll be better when we get old. We'll be more open. Yeah, it's some people, they are open. But in general, most people, they're pretty resistant. Like even our own in-law, right? They feel they're capable. And it took us a while to convince them, why don't you just try it? Try it once to see how it works for the cleaning service. Now they love it. Very good question. Yeah. So you might have them try, and then you see the benefits. And then also you want to know what's the cost for that. Often cost is quite a big concern. So usually we suggest a family, because children, they usually want to be, they say, oh, I want to be honest to our parents. I want to tell them, right, whatever it is, they need to be keeping the loop. Well, most of the elderly people, they don't want to pay that much money, especially people in their like 80s or 90s. That's a lot. They're saving for the rainy days. Or they want to save their money or housing to their children, even though the children sometimes they don't want that. They want what's the best for the parents. So sometimes we kind of, it's good to have a white lie. And then we can just simply say, you don't need to worry about it. It's taken care of. Or for the family or the parents, they're really care for the cost. You say, you know what? There is a free program, so you don't need to worry about it. So it's good to prepare in advance if you can, like have a durable power of attorney for health and finance. So then they don't need to worry about it if they're willing to. Some people, they are so strong and independent, they don't want them to take over. But it's good to have the conversation early on than later when it's too late. Thank you. That's a good question. It's very common.
Yeah. And kind of related to some other questions, Megan Young posted in the chat, thanks for your presentation. You may have mentioned this, but I missed it. Or if I missed it, is there a hub or somewhere to go and look for home care services in your area? Like I'm assuming online, she's talking about where you could start looking first as like a way to start kind of that filtering screening process.
Yeah, that's also a very good question too. Each different place are different. You may start with local, like a local area agency on aging, different area, they call it differently. In San Francisco, we call it Department of Aging and Adult Services. Now they changed the name too. So that may be a good start. Some people may Google. Google is good to have those. When you enter in your area, you will see a lot of home care agencies pop up. And I would suggest you be careful when you select the agencies, like refer to the questions. And also it's good to, ideally is to have like a word of mouth. That's the most effective way. So you know, because sometimes you may see how wonderful it is on the website or even in the social media, but what's the reality? Our experience, most of our clients, they don't post on the social media. They don't even use the social media. I hope that helps. Yeah, there are those referral agencies or even online, they have they're different agencies. They say we can refer you to different agencies, but do your homework to select which is the best. Not just only go by what they say, and you can feel yourself. And you may even try the employees, ask if they can change if that's not satisfactory to you. That may help.
Okay, great. Anyone have any other questions? I think it's such an important topic to be talking about, Cho, because I think the increase for demand of this is just exploding, and there's just not enough workers and services, to accommodate, I think, the need that's out there. So I'm grateful for the work that you're doing with your agency to be able to provide care for folks. And I think we'll just watch the demand increase, is my imagination.
Thank you very much. Yes, there is definitely increasing of the demand, especially through this pandemic. We see the people, they want to stay in their home rather than go to the facility because they're afraid of the exposure. The cost is a big concern. So it's good to look into different options. In San Francisco, because housing is very expensive. So many of the seniors, they don't have that much cash, but the housing worth a lot of money. So some people may look into the option for reverse mortgage. That can be one of the options, or equity loans. And also they may piece different services together. Like say, we have clients when they're in good condition, right? They go to the daycare that can help reduce the cost. Or sometimes we suggest them to, like, if they have a family, if they need a 24-hour care, well, if the family can stay overnight, that help reduce the cost in half. And then during the daytime, they may keep the client engaged, so the client is up. But there's sometimes it's hard because elderly people, they're up a lot and they already have that habit. Sometimes does not work and they have dementia. So that's often the kind of situation where they need a 24-hour care. Some people think about, oh, it's easy to just go to a facility. When they're pretty able, physical condition is pretty good, when they go to the facility, that's easy. But when the condition declines, like say when they become bedridden, they're so confused, don't know to call for help. That can be an issue. That's what happens sometimes. Clients ask us to help their loved one in the facilities. Then you are ending up paying the facility and the private home care. So you double the cost. That's why we usually ask clients to be cautious about that, especially like the client, for example, they have end-of-life care, they're bedridden, and they're confused. But on the other hand, is well, as long as the loved one have the 24-hour care, that's my concern. It's fine in the facility. That's okay. But just be careful. If you are able to keep the person in the home, if that's something the client want to, you may look into the option. As I said, they may spend down to get services from at some place. They may have many places. They may have free medical funded services for home care. So that's an option as they spend down. And there's a transition. That's why we tell people you don't want to wait until the money is already spent down, then apply for medical, because there's a waiting list for medical and for HSS. even though you pass through those waiting period, and you still need to be able to find or hire the HSS worker, that may take some time too. So it can be a long process. Yeah, so we suggest people to plan accordingly. That's why for us, we have the geriatric care management program. We help people. That's why sometimes we work with different hospitals or other people to help them make a long-term care planning. So they want to know what they want to do first. If they want to stay at home, or it's okay to go to facility, then go from there.
Great. All right, Cho, I want to be mindful of the time. It's about 1 o'clock. Thank you everyone for attending. Cho, thank you so much for presenting. It's always great to have a MGS alumni presenting, so thank you.
Thank you very much for having me. And thank you all for attending. I know you're all busy, appreciate your valuable time. And it's always wonderful to be back to connect with Scripps and Miami. It's always deep in my heart, even though I'm in San Francisco. So whenever you have chance to come to San Francisco, if you like, let's get together.